Welcome everyone, it's Dr. Lin over at Rehab and Revive Physical Therapy. Great source of pain is actually our cars, and a lot of my patients and I, we go into your car and we check out what's going on and try to find the right alignment. So let's go into this 4Runner here and see how we can make it a little bit better and more user friendly. Alright, let's come on in. So typically what needs to happen here, so we can see that being seated in a position like this where everything's reclined, some of you taller fellas or gals, it seems great at the time, but what has to happen is we have to throw our neck forward. Depending on how you seat yourself or how you arrange your seat, it really can be a little bit more difficult to see and make more sense why you have the back pain or the neck pain or the shoulder pain that you have. So the number one thing we've discussed in our clinic is that we want to support the unsupported areas. There's quite a bit of unsupported areas, but the main one you need to be cautious of, depending on what kind of car you'd have, is to see the seat itself. Sometimes the springs are off and you may have one hip lower than the other. So you got to come in, get it checked out, and we'll see if that's kind of the issue that may be contributing to your pelvis dropping and then the pressure into your back all the way up to your neck. So right now in this actually current chair, I'm kind of testing it, but it seems like it's pretty firm and it's doing a good job, but you can see my angles are off. And so in our clinic we talk about the anterior plumb line connecting 4 dots: the neck, the xiphoid process or your chest bone, your belly button, umbilicus, and your pubic bone. So all those are creating a nice line. As you can see, I don't have a really nice line right now. So we're going to adjust this accordingly, and then I want to see where we need to put the supports. So I'm just going to adjust this up a little bit. And now that looks a little bit better. But what you can see right now is, now my legs, I just don't have support there. So I'll go there in a little bit. But what I feel right now is I need a little support in the lower back. So just grab your handy hand towels in your bathroom and put one right in the back. You got to support that. Some of you may need it, some of you may not need it at all. So, and once I feel that, my back starts to relax a little bit more. But then you can see right back here I have some support that I need. You could use a towel. So another nifty hand towel. So this is all the things to make your seat conform to you. That way it's not your seat, that way it's not your body conforming to the seat. The whole thought process of the current seat model, and so I could do it that way. But what we sell over here at Rehab and Revive is a nifty neck pillow, and that goes great. All I do is just bind that here, and then it's going to fit nicely. So right here, and then I don't have to worry about putting that back on and off. I have a little bit more of the supports that way. But what we were saying is that a lot of the seats right now that are being made are actually conforming to the normal person. And so the normal person, guess what? Their posture is like this. So those of you trying to straighten up are continually being forced to be in the posture that is actually more dysfunctional. So we got to be careful of that, and we got to adjust the seats with the supports necessary if possible. What you want to do with the steering wheel is, ideally, if you're having your hands on 10 and 2, we're going to have, you want it outstretched, however, you want to adjust it accordingly. I always suggest keeping it about mid-chest line. So if you got the tilt function, you could do that, and then that seems a little good. It might seem like I'm a little close, but you got to do what's necessary. The next thing we're going to do is we're going to check out the depth of the seat. So we're going to pause a little bit and we'll come back. So you can see right now I've got a lot of space that I need to cover. Great. And so if you have an old pillow you don't really care to use, sweaters, this is a great place to support. A lot of chairs actually have no seat depth, and that creates a lot more pressure on the lower back. We've got to be very careful. So I'm going to slide a pillow underneath here, and so this is a great time to do that. And you can see that just because I'm here, then I can be here, and I'm in a very relaxed position. So you want to be able to support the unsupported areas. It may seem cumbersome, but if you're driving and you have driving for 15 minutes and you have pain in your lower back, this is the way to go. So you can see it's really some simple fixes. One of these days I'm going to make an invention, but for now this is the way to go. So have a nice drive, and I'll see you later.